Okay. Any questions with this part? Now we're going to go into a condition that really links a lot of what we've talked about so far. Anybody ever heard of rhabdomyolysis? Shortened off with rhabdo? No? Anybody familiar with the training methodology of CrossFit? Okay. This is something that they've had to deal with. For those of you who know about CrossFit, how would you describe the activity? How is it different maybe than something else? Okay. That's part of it, right? Both of it. It's high intensity. It's as much as you can do, right? So it's pretty much to failure. There's a time, and I've never done it. I'm sort of speaking for what I've learned from people, but there's a time and you have to do as many things, whatever it is, in the time, or you have to do so many things and you do that until you do them, okay? So that's very high intensity, and so there have been some issues with it. Fortunately or unfortunately, we've had, usually I talk about, and we still talk about a little bit, but we've got some scenarios where that's happened with athletes as well, collegiate setting. So what is it? Well, within the skeletal muscle, we have a protein called myoglobin. What do you think myoglobin does? It's right there below. It's going to be transporting, hauling oxygen. Instead of this time being in the vascular system, like hemoglobin, it's in the myo muscle. Okay? What rhabdomyolysis is we destroy the muscle to such an extent and in such a quick fashion that that protein gets out into the system, eventually landing in the urine as we try to filter the protein. And that causes some issues. And we'll talk about that. Okay. So, what are the causes? See, it's like Sesame Street. One of these things is not like the other. All right? So we start off with muscle injury due to crushing. This is a severe car accident where literally we've smashed the tissue and destroyed it. Pretty severe, right? Pretty significant injury. Second, severe burns. Same idea, except now we've burnt the tissue, right? We didn't crush it. It was heated up to a level that it was destroyed. Pretty significant. So we do see in clinical settings with people who've had these. Prolonged coma, this one's a little harder to reconcile related to the others. But if you're not moving around, we see people that have rhabdomyolysis when the muscle, again, is not being stimulated, it's not being active, obviously voluntarily. If you're in a coma, that's not happening voluntarily. So that's one that's a little hard to explain from my perspective related to the others. Seizures. Anybody know anybody who's had seizures, or you yourself have seizures? How would you describe them? Have you ever seen one or just know somebody? Seen somebody? And what does it look like?
You just sit there shaking on the floor.
Okay. Anybody else?
They're like, they have no control of anything.
Okay. So it's, again, not voluntary. Right? They're not telling their muscles to do that. Involuntary.
Also, I've seen pets have seizures.
Seen a pet have a seizure. What does a pet look like?
Just on the ground, looks like they're just freaking out.
Out of control, right? But think about what's happening in that situation. Almost every muscle in the body is contracting at the same time for how long? How long do you...
Like, how long did the seizure last?
Yeah. Okay? Similar for other people? Can be,
It depends, like, I mean, we had a guy that was on a ski trip and his felt like it lasted like forever.
can be longer, but again, just even with 2 minutes. Think about if you went to the gym and you contracted every one of your muscles maximally for 2 minutes. How much muscle damage would you have? Tons, right? Trying to lead to the one that, again, doesn't really make a lot of sense and should not happen, okay? Snake bites. This is, again, with the neurotoxin. We might talk a little bit in the nervous system that just starts destroying the tissue, right? It's kind of like these two, except this was mechanical, this was a heat, this is a chemical, right? It's just destroying the tissue, right? It damages the tissue. And again, has anybody got bit by a snake before? Know somebody got bit by a snake? I've never asked that before. Did they have like a big hole in their arm or leg or something where it was bad enough that a poisonous snake can be like a...
Like, he got like medicine, like really quick.
Okay. The anti-venom, right? But again, that's what we're talking about is when we, in a relatively short period of time, we're destroying a lot of muscle tissue. Now, the one that doesn't fit to this is the last one. Extreme physical activity. Where do you think we saw this first in people that wasn't one of these kind of clinical things where they'd go to the hospital and we'd figure out, oh, we do the test and they got a bunch of myoglobin in their urine and yep, they got rhabdomyolysis. We got to treat for that too, on top of all the other things. Where do you think we saw extreme physical activity? Think about people who are required to do lots of physical activity. They're really not allowed to say no. The military, right? What was the person in charge going to say if you're like, I'm done. That's good enough. I think I got enough push-ups in today, right? You don't have control over that. So that's where the initial ones. And then I mentioned we've seen it now, unfortunately, in college athletics. The story that I typically tell came from the University of Iowa. It occurred now probably at least 5 years ago. And there's a mentality to this, so that's why I tell the kind of the entire story. They didn't do very well in their season. They didn't go to a bowl game, so their season was pretty much over in December. And so they couldn't practice, they couldn't do anything. And then, just like us, their semesters start back up in January, and that's when they could start training again. Well, they had lost a few games in the fourth quarter after being ahead, and so the idea was that we're going to have a strategy or a mentality that we're going to finish everything to the end. Okay? And so they started training, and after the first week of practice into the next week, they had 13 people in the hospital. Okay? That's not good. Okay? Why it probably became news is because the parents were pretty mad that the head coach did not come back to campus to check on the 13 people in the hospital because he was out recruiting. And if you're not involved with sports and athletics and recruiting, 2 weeks ago, beginning of February, was signing day for football. So that's, and other sports, but football gets kind of the press on that. So that was a key time in recruiting, and he did not feel it necessary to come back home to make sure that his current athletes were okay. So that's probably why it became news. Otherwise, it may have never even surfaced. So they sort of figured out, well, how did this happen? And they learned that the workout included sets of 100. So like they were doing curls of 100 and squats of 100 and bench presses of 100 and push-ups, kind of all back to back to back. And some people could handle it, some people couldn't. What do you think happened in the month before this training occurred? Some of the people probably did nothing, right? Season was over, no bowl game, did my finals, went home, sat on my couch. Even Division I athletes, right? Some of them probably trained a little bit. Some of them maybe were a little bit older and had trained more. It was something they said they'd done before, but that's really the combination that's really damaging is physical inactivity for a period prior to, and then heavy physical activity immediately following that. I said, fortunately, unfortunately, we got a news story 2 weeks ago. University of Oregon, they put 3 people into the hospital. Similar situation, did not make a bowl game. A little bit different in this situation. Well, we'll save that to the end. A little bit different in this situation that they have a new coach. Okay, so they got a new coach in that time, and so they got a new strength coach in that time. And again, they did similar types of things where it was just continuous movement. And so they put 3 people in the hospital. Now, our question is, do either of these people still have their job at the current place? Again, the Iowa's been a little longer ago, so did he keep his job then? And then this one was just a couple weeks ago. Does that strength coach in Oregon still have his job? What do you think?
Yeah. The one in Iowa was like the highest paid in the country. I think it earns like over $500,000 a year.
Yes. The Iowa coach kept his job. He played dumb, which again is not really cool in my book. He said he didn't know anything about rhabdomyolysis. They had done this workout before, and so what did he have to do? He had to go through some training and learn about that. That's your job, okay? And again, someone who's involved and interested in strength and conditioning, there were multiple articles before that talk about rhabdomyolysis. So that tells me you don't read anything related to it. But you should also be smart enough to know that that's not an appropriate training. And then, so now this past year, guess who's the highest paid strength coach in the country? This guy. And yes, it's approaching $500,000 a year to be the strength coach for the football team at Iowa. And I think most of us would agree they're not the best team in the country. So, now, we have our Oregon coach. What happened to him? Any ideas? He too did not get fired, even though he'd only been on the job like 7 days. He got suspended for 30 days. Can't do anything. The other part of the story, and again, I know all of you don't care about strength and conditioning, but I have to, since I teach in the classes, I got to teach people who are learning about being a coach. They had fired their head strength and conditioning person, but he stayed in the department, and he was doing, I think, baseball and maybe tennis or something. So, and he'd been there like 30 years. So they got rid of that guy. The new football coach got rid of that guy. And he's doing baseball and tennis. Well, now they suspend this other guy. Guess who's now the director for the 30 days? The guy who they demoted to baseball and tennis. It's an interesting world of what people think is legitimate. Okay? But again, hopefully that tells you that we can do too much. That's one thing, right? People think, oh, I've never done a workout that, there's no workout that I can't do. Yes, there is, right? If that was my goal, I could do that very quickly to you. That's not the goal. Okay, so what happened? We'll look at what happens next, and then what happened to them once they went into the hospital. What were the side effects? So, what are the symptoms? Well, first symptom, muscle soreness. Okay, I'm doing resistance training. What is the coach going to say if your muscles are sore?
Good.
Part of it, right? I mean, it's supposed to be sore to some extent, right? That's the point of adaptation, is if you're not doing more than you've done before, they're not going to be sore. But there's a level to that. Or, again, in both of these situations, they probably said, well, what did you do the last month? Sit on your couch? That's why you're sore. These people aren't sore. Okay? Stiffness and weakness. Again, kind of natural in physical activity to have some muscle soreness, but then also stiffness and weakness. Keep those in mind. Fever. Why would they have fever? Why do we have fevers in general?
Killing vaccine.
Yeah, we want to heat up the cells until they die, right? So this happens in physical activity, right? You do exercise, after the fact, your body's temperature stays elevated, and part of that is that we're starting the recovery process. We're not fighting an infection, but we're fighting muscle damage. Well, they got a whole bunch of muscle damage, so they're going to have fever. And then nausea, right? Again, unfortunately, in especially strength and conditioning culture, that's like cool in some instances, right? If you work so hard that you threw up, then you really worked hard. Is that a real smart move? What did you just do? You just threw all of your energy from the last day or whatever into the garbage can. You can have a real good workout after that. You can have a real good workout the next day unless you replaced all that plus more. No, it's stupid, right? But again, that's the reason why they might not have figured it out right away. This is what gets people to figure it out. When your athlete comes to you and says, I went to the bathroom and looked like Dr. Pepper, right? That gets people's attention, okay? So typically, and again, most of you know, should be pale yellow, right? Indicating hydration. It should not be red or cola colored. So that's what got them to the hospital and treatment. Now, what happens? What are the side effects? What are the complications? And this is why it kind of all ties together with what we've been talking about. Well, first of all, we have hyperkalemia. Potassium goes through the roof. What is potassium responsible for? Say it again? Yeah, it's part of the depolarization process, right? Sodium-potassium pump. We get those things out of whack with so much potassium, that causes issues. We said you couldn't decrease your calcium levels, right? It's pretty hard to do that unless you do this, because then it results in hypocalcemia, decrease in calcium. We said muscle weakness. Why did they have muscle weakness? Because they didn't have calcium. Related to both of these is not just skeletal muscle, right? We've got cardiac muscle. So the same impact, we're not getting the muscle damage as much, but if we've got less calcium, or we've got more calcium, less calcium and more potassium, that could throw my heart into an arrhythmia. Renal failure, acute renal failure. What's renal system? Kidneys, what do the kidneys do? Big filters, right? Again, we just threw a whole bunch of protein in there. We need to get that protein out. It's got to filter it. That's what ends up in the urine. That's a lot of work for the kidneys. Okay? So that's something that potentially could be not real good for you. Then compartment syndrome. Anybody familiar with this? What's compartment syndrome?
Like you're, well, I don't know, the only reason I know how it was like we had one of our friends got in an accident and he had his leg around his artery was like, when he was like pushed against the dash, like he was still good, but when they released that pressure, all the blood flow, like.
Okay. So it kind of, well, it gives you a little bit with it. The compartment is a closed space, okay? If we flood that space, and typically where you'll see it in exercise, or can be in exercise, is in lower limbs, so the lower leg, and typically on the front, okay? It's a relatively small compartment. We throw a lot of blood, or again, if the muscle's been damaged, reparative procedures in there, right? That's, again, the muscle pump, not the muscle pump we've been talking about, the muscle pump like this, right? Floods in there. There's only so much space. If it cannot get out, then we have compartment syndrome. Now, that's not shin splints. This is a muscle thing. The shin is a bone, Okay, so sometimes people are misdiagnosed, related, not misdiagnosed, but think about those kind of things. But what do you have to do? Literally, you have to cut it open and take the fluid out. We actually had a student a couple semesters ago who had that. He just had a big divot in the front of his shin where they had to cut it out because the pressure had built up, and there was no place for it to go. Okay. Now, what do we do for treatment? Well, before we get to that, so what happened to the Iowa guys? They were in the hospital about 10, 11 days. So, again, in terms of football in the spring, they have their spring season. They missed 10 days of training. After that, it took over a month before they could really start to do some physical activity. And then even a more significant time to really get back to training. Okay? So that was brilliant maneuver, right? You took at least 13 people and they didn't do anything for 3 months. Okay? Brilliant. $500,000 a year. Okay? That leads to sort of what they did, and then it's rest, right? Initially, it's literally bed rest, no movement. Okay? We've got to get that reparative process going, and if you're up moving around, that doesn't help. Okay? And then fluids. Fluids, again, to try to get the protein levels and save the kidneys, right? We get more fluid in because the kidneys are trying to filter. Well, to get the protein out, I got to keep going to the bathroom, keep going to the bathroom, keep going to the bathroom, right? Just like alcohol in terms of dehydration. So they had guys who lost, and you would imagine, obviously, these are the bigger guys, who lost like 30 pounds because they just shriveled up, right? They had to get rid of that protein, and they had to try to maintain with their fluids, but they lost a lot of that weight. Again, it's fluid weight, but that's obviously not a good thing. But there was muscle damage too, so there was a significant amount of muscle mass that was not going to be recovered. Okay? Any questions with this? That's really what we've got. So again, that part kind of puts things together, right? Again, the importance of calcium. How it interacts. Exercise. Do I have any questions? Okay. Tuesday, I will not be here. Been invited. We worked with the National Guard this past summer, and I've been invited to be at a luncheon with the Major General and some other people, obviously, for luncheon to Camp Atterbury to look at their fitness facility. We're the only state in the country that doesn't have a military base, right? It's National Guard. To have its own independent fitness place. So we're going to get a tour of that, get some lunch, and talk to them. So, and that's like 3 hours away. So, and it's right during class. So I will not be here, but Mr. Ensler will be here. He's our rec and fitness director. He teaches our biomechanics. And he's going to take you through a lab. Okay, so wear comfortable clothes. It's not going to be a real physical lab in terms of moving around kinds of things, but you're going to do some push-ups and some curl-ups and some flexibility things. So just comfortable clothes. Okay, so yesterday we started to look at the basic structures of the muscle. I went through the ultrastructures, so the individual filaments, actin and myosin, and then how we get to a contraction through EC coupling. Today we're going to look at the functions, principles that the muscle has that are a little bit unique, and then we'll get to the actual muscles and going over those as a the next level again in a movement analysis of what muscle is causing that specific movement. So when we look at principles, again, probably the one you think of the most is movement. So for us to move, right, the muscle has to contract. So 100% of body movements are caused by muscle. But we also have protection. All right, we talked about in the skeleton how certain bones, which were those? Which ones were protected? Flat bones, right? So we're adding another layer. So we've got large muscles, again on the torso, on the anterior side and the posterior side that try to put some distance between whatever. Again, it could be a car crash, or again, if you think about sport, right? We try to hypertrophy the muscle as big as we can so we don't get squished. When we get hit with a tackle, when we get knocked off balance. So we do have that protective effect of padding, putting distance between the organs or even the skeletal system in those types of events. Posture and support. So again, this skeleton here needs support, right? We just stood it up, it would fall over, right? It needs the rod up through the spine for everything to stay in position. That's obviously done by the muscular system. So we have postural muscles. So muscles that help us just, like I'm standing here, right? There's activation of the muscles. So again, in our stance, right? When we think about the movement analysis part, when we're in our stance, there's muscle contraction even though the muscles are in neutral, right? There's no movement of that. The joint hasn't moved. And we'll talk about those types of contractions. But there is muscle contracting. So let's do a little postural experiment. Go ahead and sit up in your chair so your back is not touching the chair. You tell me when you feel it.
That's not touching.
And just sit straight up. So like as if the chair wasn't there. Back of the chair wasn't there. It'll be a while. Hopefully you've got a good postural control. Okay? And then, again, we've talked about the mitochondria within the muscle cell producing all that energy, but we're very inefficient. So a lot of what we produce is just heat. Again, that's a positive. We can shiver to try to improve our body temperature if we get really cold. So those are our 4 primary functions. Just like with the bones, we're by no means going to cover all 600 muscles. We're going to look at the ones that are most important for pretty dynamic movement, right? Not that control the eye or even of the hand and the foot. But it is about half our body weight. So it's a significant percentage of our overall weight. They usually work in pairs. You can see not all. We don't have 300 pairs, but pretty good percentage, 70% work in pairs. And so we have an agonist and an antagonist. Anybody give me an example of that? What would be an agonist and an antagonist?
That's it.
Okay, so for elbow flexion extension, right? The agonist for flexion is going to be one of the bicep flexors. So we said biceps brachii. Right? The antagonist is going to be the one who does the opposite motion. So that's the triceps. Now, if we were saying elbow extension, right? So now we're going from here to here. The agonist would be the triceps, and the antagonist would be the biceps. So they just work in opposition to make those levers work. Most often there's not just a single muscle. All right, we're going to take a couple of muscles and do what we call aggregate to make a muscle, to make the muscle group work together to get the joint to contract. So again, even with bicep flexion, there's more than one elbow flexor. Depending on how we have our hand position and what type of movement we do, we'll aggregate and bring in a couple other muscles to get that to happen. How are they named? Several different ways. They try to help us out a little bit. Shape, size, number of branches, location, attachment, or action. All right, so shape, the deltoid. Size, the gluteus maximus. Number of branches, biceps. So that's 2 branches. The location, tibialis anterior. Where's tibialis anterior? So we've gone over terminology, right? On the front side, right? Anterior tibia. What does it do? Motion. Brings it which way? Bring it towards you or away?
Flexes and moves towards you.
Yep, so that's called what? Dorsiflexion, right? Okay. And that's what I mean by when we talked about the origins and the insertions, we need to know the general location, right? You can make the muscle contract, hopefully, most of them, to identify what action it will do. But if I know that it's attached on the front and I feel that, right, then I know it's going to be dorsiflexion. Brachialis, again attached to the brachium or the humerus, and then action, we'll look at the rotator cuff as an example. All right. So a bunch of different ways, and they try to help us out a little bit so we can identify them. Again, for the purposes of what we do, right, we're not looking at people with no skin, right? So we can see every little muscle, right? So that's why, again, origin insertions will help for sometimes injury. We can test and determine, but that's still more based on the action. It's not just looking at it and say, oh. But there are some elements. I remember I started off in athletic training, and one of the things that they would use is a tuning fork, right? So they tapped a tuning fork, and then they placed that in the area to determine which muscle it actually was, right? Because then it'd vibrate. Everybody know what a tuning fork is? Right? It'd vibrate, and so it'd vibrate the muscle or the ligament or the end of the tendon, and so that would give you kind of an idea. So you had to know those exact locations, but for the most part, we can test through an action with a lot of the muscles we'll be talking about, and we'll kind of do that. In terms of neuromuscular principles, so what can the muscle do? What are its capabilities? Well, we want it to produce force. And often we want to produce force maximally. So we might want to have the muscle as big as we can be. Greater diameter equals more force. Right? So the bigger the cross-sectional area of the fibers, the body and the belly of the muscle, the more force it's going to produce. That's probably not too, it's pretty obvious. In terms of length, longer muscles are able to contract through a greater range of motion. If I have a greater range of motion, I can produce more force. Yep.
Is it true that it's harder for somebody like on a bench press or something like that if they have long arms because the muscles are a little longer?
I mean, most of that is the distance they have to push, right? We talked about Shaq and how big his hands are.
Yeah.
or Kevin Durant, how long his, again, I'm pushing, and again, we do this in the biomechanics class, Mr. Ensler does this to determine power. We need force times distance, so we have to see over time how fast you do it. Well, we can push the same, but average person pushes like 20-ish inches, 17, I mean, I've seen like 17 to like 22. He's probably pushing 30 plus inches, right? I mean, his arms are significantly longer than an average person. So for him to push that extra foot is part of what makes it different. And then it is getting farther away from where the muscle's contracting. So the control out at the end of that lever is more difficult. Related to the length of the muscle, again, still proportional to him. So sometimes people have a little longer tendon, and often you'll kind of see that in biceps, so they'll have a pretty good space between where their bicep kind of pops up and the elbow, right? A little bit longer tendon attachment that may change things a little bit in terms of, again, the biomechanics of it. But really with the bench press, it's that distance. It's another foot that I have to push. With the similar, I mean, obviously he's a big guy, he has big muscle mass, Shaq, but Kevin Durant doesn't, right? I mean, he didn't have a chest out to here. He's a lean guy, so he's pushing that full distance. So, and then vice versa, if you've ever seen power lifters, right? They just want to be as big as they can, right? They want chest up to their elbows, so they just have to go, ooh, right? They might push 10 inches. They don't want to push all that distance. So it's kind of, for how and how much, I think more that distance. But it is, once I get in the end of that lever, that's a long distance away from where the muscle is contracting. So it is a challenge even at the end of that arm. Okay. This is also a challenge for velocity type sports. So the example I typically use for this is Randy Johnson. If you're familiar with Randy Johnson, he is a pitcher, 6'10", right? So similar like we're talking about Shaq, Kevin Durant, really long arms. So it'd be to his advantage to use those. But challenge for him is he can get so much torque if his arm was fully extended that he would have shoulder or elbow problems. Right? So if you've ever seen him pitch, he short arms the ball, right? His arm, when he gets back here, is not lengthened, right? It's not extended, it's short. Right? He uses that. Again, other sports, tennis, right? There was a guy, Goran Ivanisevic, who was, again, like 6'10". There's probably a newer guy who's 6'10", right? Plus you add the length of the racket on there, they're the big hitters, right? They're the big servers. Doesn't hurt that he can serve down when I play tennis, right? I have to serve up to make the ball go down, right? If I hit straight, it's going to go out, right? The line of the trajectory of the ball is going to go out, so I have to hit up over the net and then put it on spin to get it down. But they're just bobbing straight down, so that part helps too. But using that length, and you won't see them short arm their serve, they're going to be way out there. So the velocity isn't quite as bad, but sometimes you'll see, I think he had shoulder problems. So next is the arrangement of the fibers. And again, you've probably noticed this before, and we'll kind of check it out as we go through the individual muscles, the arrangement. So is it parallel? Is it pennate, which looks like a feather? Those are the ones that are most powerful, right? So how they're aligned. Last part, and again, this is kind of a unique property for muscle. Irritability, contractility, or contractibility, extensibility, and elasticity. All of these play a role. Irritability, response to electrical, chemical, or mechanical stimuli. All right, so electrical, right? Anybody ever used a stim machine before? Right? Put the little electrodes on, turn it on, zzz, muscle contracts, right? So it's responding to electrical signals. So We obviously send electrical signals, right? We talked about that yesterday. The depolarization, that was an electrical signal, right? And we're changing the polarity of the muscle membrane. It spreads across for us to get contraction. But we can do that externally. We can also do that mechanically. Anybody think of how a muscle could react related to a mechanical stimuli? No? Well, this is like a reflex, right? If I strike the patellar tendon, that's going to cause a reflex. That's a mechanical stimulus. And then chemical, again, we see with ATP, with the use of ATP to create energy, that goes all the way back to our acetylcholine and the steps that come down for it to contract that. Again, probably most familiar of these properties would be contractibility, so ability to shorten and generate internal tension. So shorten. These two you want to make sure you don't get mixed up. Extensibility is the ability of the muscle to stretch back after a contraction. That's extensibility. And elasticity is the ability of the muscle to stretch back to its normal position after it's been stretched. Okay? So how can we remember those two?
Elastic stretch.
Okay? What stretches back after you stretch it? Rubber band, right? Piece of elastic. You know, I don't think we have any that will last anymore. Our elasticity for our rubber bands has diminished significantly, right? But if we stretch the muscle out, you don't want to stretch it too far. You stretch the muscle out, it goes back. That's important, right? I don't want to be stretching, right? Lengthening out my muscle, stretching out my muscle, and it to stay that length, right? We said there's an optimal length, and we said don't stretch before we do power type activities because we've lengthened that out. We want it to come back to a normal resting length. So that's that one. How about for extensibility? Think of something that contracts and then returns to its shape. Yeah, I mean, all the muscles have these properties, right? So each of the muscles, but how can we remember maybe something, a different type of material, like the rubber band, that contracts down and then returns to its shape? Sure, right? Stress ball, memory foam, something like that, right? Right? You have one of those fancy memory foam beds, you lay on it, your body's there, right? You get out of the bed, pops back up. Right? Or a stress ball, you squeeze it, and it returns back to its shape. So that's extensibility. Same thing, right? I don't want to contract my muscle and then not come back. Right? We want it to go back to its resting length. So while it seems like fundamental, right, it would be a challenge if they didn't. And there are some conditions where that doesn't happen. If you've ever heard of, remember, the general non-scientific is handshake disease. Somebody shakes your hand and their hand stays in that position. Takes a long time for it to relax. Myotonia, that's what it's called. Forms of myotonia. Okay? So again, these principles can be applied in other areas, in disease or disability or pathophysiologies, right? So when they go to squeeze your hand, it doesn't relax as fast as it should, right? As if you shook their hand. And part of that is the extensibility in that process, for some reason, is slowed. And that's another application. Okay. In terms of neuromuscular principles and terminology,